Hello friends, welcome to Gut Fit Club. We are here with another one informative session about the anal manometry. We are having expert Dr. Rupali. She is a gastrophysiologist. She is working as a full-time gastrophysiologist in Kaizen Gastro Care. And anal manometry is one of the GI physiological tests. We'll understand about it from the expert. Dr. Rupali, what is exactly means the anal manometry is?
Anal manometry is basically an advanced GI diagnostic test. In this, we'll come to know about the pressure changes into the rectum and anal canal. And along with the knowing pressure changes, we'll also come to know about the coordination between the rectum and anal canal.
That means it's an understanding about the physiology of the anal canal by using the machine. How does exactly procedure done here in the Kaizen Gastro Care?
Procedure is very simple and non-painful. With the help of one catheter, which is hardly 0.5 mm, which has a balloon and some sensors attached to it. So that catheter is passed into the rectum through the anal canal, and we'll come to know the pressure changes through the instrument on the TV screen. Here we ask for some of the maneuver to be done by the patient, like squeezing of the anal canal, then pushing efforts how we do normally in the defecation. Then with the help of that balloon, we put some air into the rectum, and we'll come to know about how is the volume capacity of the rectum. So these are some of the things which we usually do in the procedure of anal manometry.
That means anal manometry is a simple test and which is painless, need not to fear about the anal manometry. What precaution you suggest for someone getting the anal manometry? Is there any specific precaution like fasting anything is needed?
There are no major precautions which are required for the anal manometry, not even the fasting. So patient can have a light food if he is planning to do it in the morning. A patient can even get it done in the evening hours after lunch also. Only required thing is the bowel has to be clean, either with the natural process of defecation, or we can administer enema before the procedure if bowel is really loaded.
What is exactly indication of doing anal manometry in GI diseases?
So anal manometry is basically recommended or indicated in patients who are suffering from chronic constipation and also from the fecal incontinence. In case of chronic constipation, almost 1/3 of the patient actually suffer from dyssynergic defecation or from the obstructive defecation syndrome, and this cannot be picked by any other modalities. So this will be picked with the help of the anal manometry, and these are the patients which cannot be benefited with the help of laxative, so they will require this for diagnosis as well as for the therapy in case of biofeedback for the chronic constipation. And for fecal incontinence, we will come to know about the which muscle or which sphincter is exactly weak, and we can help by biofeedback for strengthening. So these are some of the indications like chronic constipation and fecal incontinence.
That means prior days it used to be colonoscopy, and after that people used to be on the laxative. There was no modality. Means this advancement of manometry, exactly they can understand what is happening, and accordingly you can give a biofeedback therapy. What exactly you do in biofeedback therapy?
Biofeedback therapy is basically a simple therapy. It is not like some surgery or putting on some medication. It is basically retraining the normal process of defecation to the brain by reinforcing it by some visual or some auditory stimulus. So here the aim of biofeedback therapy for chronic constipation is to focus more on anal relaxation, and in case of fecal incontinence, the focus will be more on strengthening the anal strengthening. So and some other modalities are also available. Depending upon the cause or dyssynergia, we will advise the biofeedback therapy.
That means for the chronic constipation, if having chronic constipation not getting corrected, which can be diagnosed on anal manometry, and also it can be corrected by giving biofeedback by the anal manometry machine. That's what you mean to say. Thank you for this video, and we will see few of other things in gastrophysiology in upcoming videos.